Hi everyone, today we are going to talk about a phobia. A phobia is an anxiety disorder involving excessive and persistent fear of a situation or an object. Exposure to the source of the fears triggers an immediate anxiety response. There are three types of phobia. First, specific phobia. These are the common form of a phobia, such as fear of snake, cockroach, butterfly, or even sharp objects. Second, agoraphobia. This is a phobia in which people avoid places or situations which make them feel uncomfortable. For example, being afraid of crowded places, being afraid of tight space. Third, social phobia. Teens suffering from social phobia are afraid of social situations that cause them to be the center of attention. For example, speak at the front of a room, speaking even through a microphone, or even getting on a bus. Symptoms of phobia. The symptoms of phobia are excessive, unreasonable, persistent feeling of fear or anxiety. They are triggered by a particular object, activity, or situation. Second, feelings that are either irrational or out of proportion to any threat. For example, while anyone may be afraid of unrestrained dog, most people do not run away from a calm, quiet animal. Third, avoidance of the object, activity, or situation that are trigger the phobia. Because people with fear recognize that their fears are embarrassed about their symptoms or often assume. To prevent anxiety symptom or embarrassment, they avoid the trigger of phobia. Anxiety relates physical symptoms. This can include tremor, palpitation, sweating, shortness of breath, or other symptoms that affect the body, fight or flight. Response to danger. Symptoms such as this may lead to a diagnosis of panic disorder. Diagnosis phobia. A mental health professional is likely to ask about current symptoms and family history, particularly whether other family members have had phobia. You may want to report any experience or trauma that may have sets of the phobia. For example, a dog attack leading to a fear of dog. It may be helpful to discuss how you react to your feeling and physical symptoms when you are confronted with the thing you fear. Also describe what you do to avoid fearful situations and how the phobia affect your daily life, including your job and your personal relationship. Expected duration of phobia. Incident-specific phobia can be short-term problems that disappear in a few months. In adults, about 80% of new phobia become chronic, long-term conditions that do not go away without proper treatment. How to prevent phobia? This is no way to prevent phobia from starting. However, treatment can reduce the negative impact of disorder. Treatment phobia. Treatment usually includes some combination of phytotherapies and medications, depending on the type of phobia. Specific phobia, cognitive behavior. And for the special part, we are going to talk about a list of phobia for a little more. First, acrophobia, fear of height, aerophobia, fear of flying, agoraphobia, fear of pain, agoraphobia, fear of open space or ground, androphobia, fear of men, anemophobia, fear of air, anginophobia, fear of angina or choking, agoraphobia, fear of anger, anthropophobia, fear of flowers, aquaphobia, fear of water, astrophobia, fear of outer space, astraphobia, fear of thunder and lightning, ataxophobia, fear of disorder or untidiness, autophobia, fear of being alone, bacteriophobia, fear of bacteria, chromophobia, fear of color, chronophobia, fear of time, cybophobia, fear of food, primacophobia, fear of crime, cynophobia, fear of dog, gamophobia, fear of marriage, gynophobia, fear of women, heliophobia, fear of the sun, amophobia, fear of birds, technophobia, fear of technologies, zoophobia, fear of animals. And this is the end for today. Thank you for watching and listening. Goodbye.